and Wellness in Anaheim Hills, California. I'm having a hard time figuring out where to look. It's like up here, down there, but it looks like here's where we need to be. So I'm happy you could join us today. We're going to be talking today about vitamin D and its importance in your immune health. This is a big one, guys. I know that everybody's getting really tired of being home on quarantine, on stay-home orders, however you want to label it. But we feel very helpless. We're sort of relying on news media, Facebook, Instagram, all of these other things to give us new information. We're sort of seeking that information because we feel a little bit powerless in other regards as far as how we can best help our health. When can we go out again? When can we be around others? What can we do as we're just sitting in fear, waiting for this wave of COVID to strike all of us? And I'm here to reassure you that there's a lot of ways that you can implement to really make yourself healthier. And that's what I want to make these next few Wellness Wednesdays about. Today will be vitamin D. We'll be talking about turmeric benefits, vitamin C benefits, exercise, sleep, having a schedule. All of these things are just so important for our overall health, our overall immunity, to really make sure that you are feeling at your best and you have your best immune defense from keeping COVID from affecting you. Or if you do get COVID, that you are actually able to fight it off relatively easily and not go into a situation where you're then needing a respirator, needing hospitalization. Okay, so I want to walk it back. Vitamin D is a pretty phenomenal vitamin, and it's really actually a hormone that our body produces. And that being said, we're very, very undereducated within the medical community about the benefits and utilities of vitamin D. We're basically told in medical school, so this is why I don't want you to be too frustrated. Don't be too hard on your regular primary provider, because they just may not have been educated on it. Even talking with some of my friends, I have a lot of individuals who will tell me like, oh, you believe in this stuff and that sort of thing. And really, it's not about believing. It's about seeing the appropriate literature. So I actually just went back. I did a whole literature review. And looking at this, there are a lot of utilities to vitamin D. So what we're taught in medical school, coming back to that, is that vitamin D is fundamental in helping us to absorb calcium through our intestines so that we can then deposit it into bone. So vitamin D is necessary for calcium to get into the bone and build bone and prevent us from osteoporosis. So everybody should be on calcium and vitamin D, the end, right? So that's what we're kind of told. And that's sort of the underlying belief system. Now, we use vitamin D levels from a level of about 30 to 75 to 100 is sort of the overall range that we look at as a normal range on our lab reviews. Now, what are those labs based on? Under 30, we know that you can display bone loss and have an increased risk of osteoporosis. And above 100, you can display elements of vitamin D toxicity, which can be dangerous. So anywhere in between there, then you are normal. But what they didn't look at when they were establishing these normal levels is what really optimal levels should be. So a lot of times when you go into your doctor, they're looking at your vitamin D levels and they say, oh, you're fine. Your vitamin D levels are fine. Good job. Don't worry about anything. You're doing great. But what is that vitamin D level? So if that vitamin D level is 28, well, then it's not fine. Even if it's 30, it's not fine. Because traditionally, like within our practice, we really shoot for a vitamin D level to be optimal between 60 to 80. Now, I know that there are some schools of thought that go even higher and they're like, gosh, push it, be between 100 and 120. I don't necessarily recommend that by any means. Again, there's not enough known about those higher levels. Sorry, I thought I turned off notifications. Well, we'll just work through it. That being said, really 60 to 80 is what we target in our practice, and people are known to do better. Now, what does that mean better? And that's what we're going to talk about today. So a very common saying that's out there, and you'll see me post this later, is that sunshine is the best disinfectant. This is an old saying. We've known it for a long time, even back in the 1850s when we were treating patients for tuberculosis, the sanatoriums. What they would do is take each patient out onto the patios and the balconies every single day for sunlight. They thought sunlight actually directly killed the tuberculosis bacteria. They kind of weren't wrong, interestingly enough. So maybe they didn't know exactly why. We know a little bit more about why in the limited studies that have been done about vitamin D. But that being said, what vitamin D actually does is it converts within the skin. So we actually absorb it through the UVB rays to actually convert goes down hydroxylated. So we need a functional liver in order to have that D synthesis happen the way that it's supposed to. Then it gets transmitted and carried over to your kidneys, which convert it again, and then it's actually in its active form. Then when it's in its active form, it cruises down to the intestines. It looks for calcium, right? And then it picks up the calcium and deposits it to the bones. So that's what we originally understood. End of story. That's it. Remember, on your test in medical school, when it says vitamin D, you put bone structure, bone strength, whatever, right? That's it. That's all we learned. But what we're now finding is that those vitamin D receptors, or actually VDRs is what we abbreviate them in the literature, those VDRs are actually seen on immune cells. Surprise, surprise, right? They're seen in thyroid cells. They're seen in brain cells. So vitamin D is fundamental in so many functions in our bodies, and again, grossly overlooked by the larger medical community. This is critical, guys. Make sure that you're really paying attention, okay? So with that, then vitamin D and immunity. What do we know about immunity? And we've talked about this before, about cytokine storm and basically body's response to COVID. Oh, hold on, there's a question. How much vitamin D can we take to get to those levels you mentioned, between 60 and 80? So I generally recommend, it depends on where you start, right? So if you start and you're already kind of a rock star, you're hovering around 50, then you don't need to take all that much, especially if you have a job that takes you outside, you're getting some sun exposure. You may actually, with just minimal supplementation, be able to get to those levels. But otherwise, I am generally recommending about 5,000 international units per day orally, and that's either a tablet or even under the tongue, so you get some oral absorption, mucosal absorption, so that you don't have to rely on your intestinal absorption. Again, this comes back to gut health, which is also one of my favorite topics, because you can take all the vitamin D in the world, but if your gut health sucks and you're not absorbing things the way that you are supposed to be, then it's kind of all for naught. So we really have to look at those factors together. So I would definitely recommend talking to your provider. Give me a call. I'll be happy to talk with you about it. Let's look at your numbers and we can kind of go from there. Okay, so I hope that answers that question. Okay, so getting back to kind of what it does on the immune cells. Actually, I wrote some notes down. When bacteria enter your body, now this discussion is a little bit about bacteria because that's what was studied, but we also know that increased vitamin D levels actually statistically significantly, that's a big medical term, right? Statistically significantly decreased the number of influenza cases in a study that was done. It also showed decreased infection with HIV, decreased incidence of bacterial vaginosis. So again, it kind of translates to viruses as well, but the study specifically was looking at what does it do with bacteria. Okay, so bacteria have a special type of cell membrane that our body recognizes as foreign. Okay, and that's called a lipopolysaccharide, LPS, right? So it recognizes this lipopolysaccharide and it says, hey, you don't belong here. Okay, so then it activates those macrophages, or those particular aspects of our white blood cells actually activate all sorts of pathways that then say, hey, we need to go and attack this lipopolysaccharide. So then our phagocytes actually come, they're like little Pac-Men, and they go and they eat the bacteria, and then all of our cytokines, all those inflammatory factors actually go into that cell and they dissolve and break down that lipopolysaccharide membrane, leaving that bacteria basically exploding. Okay, so that's what we want to have happen. That's a normal function. So what about vitamin D? Vitamin D actually is very fundamental in that next portion where we recognize it and then we have to bind to certain receptors in order to produce the cytokines that then eat the bacteria. Does that make sense? So those peptides, or those little proteins that get secreted from the cell, our bodies are so amazing, but those little peptides can't happen without vitamin D binding. Okay, so you need adequate levels of vitamin D in order to fight infection. So this is almost direct antimicrobial, basically antibiotic type of activity that vitamin D demonstrates. That's a big deal. Okay, so aside from taking antibiotics and worrying about hydroxychloroquine and all the things that are in the news, we need a vaccine, we need a treatment. Get your vitamin D levels up, guys. It's going to help you substantially in getting to where you need to be as far as immune strength and ability to fight off viruses or bacteria as they present themselves to the body. So again, in going back to our cytokine storm, remember we've talked about IL-1 or interleukin-1, interleukin-6, 8, TNF alpha. These guys are all big players in starting to potentiate and perpetuate that cytokine storm. Once they sort of like, we trip that trigger on, we flick that light switch on, it's difficult to shut it off, okay? Now we want some inflammatory response because we have to tell our body like, hey, there's something going on here, this isn't right. And then it deploys all other pathways to help to kill and, produce antibodies, kill that bacteria or virus. So we want some of that, but we don't want too much of it to where it starts destroying our own tissue. That's cytokine storm, okay? So that's the difference. The trick with modern or conventional medicine as we know it is the nuance of being able to shut down the inflammatory response without also shutting down the immune function. What do I mean by that? So a lot of us with autoimmune diseases and, we have these hyper-inflammatory immune responses to things, we're on steroids, which shuts down the inflammation, but also shuts down the immune system. You're on Humira, methotrexate, all of these other immune modulators, but they're really immunosuppressive medications. People who've had transplants, same thing, right? So we don't want our body to reject our own cells, so it's important. But really with these tricks, with the virus or with the bacteria, we need to effectively balance between cutting down the inflammation, which can ultimately kill us, but then keeping an immunity or immune response up such that we're able to fight that bacteria or that virus, okay? So we want to promote interleukin 10, which is our anti-inflammatory interleukin. So that's a good guy out there, but we want to decrease our TNF alpha response, interleukin 6, 8, 1, all of these other guys. So again, vitamin D has a direct correlation with binding and triggering which cytokines are being deployed. Another aspect of it, because this guy just doesn't stop. I mean, D is so huge. It's so critically important, guys. I cannot emphasize this enough. So that being said, the next thing that it does is it also modifies the TH cells or the T cells that are also critical with immune function. So TH1 and TH2 are pro-inflammatory, meaning more inflammation. So again, those are the guys that when you eat crappy food, crummy food, it comes into your body and your body's like, I don't like you. And it gets all crazy and you get a headache, and you get bone aches, and you feel bloated and tired and gassy and all the rest, right? So we're all kind of familiar with that if you've ever had bad sushi. That being said, again, there's a utility for that, but it needs to stop at some point. Now, what a better cell is for that is what's called our Treg or our T regulatory cells. What they do is they live just behind the intestinal walls, and they interpret everything as it starts to come in, and they deploy and say either you belong here or you don't. You belong here, you don't. So it's a sorting mechanism that's supposed to happen. Well, you only have so many T cells, like generalized undifferentiated T cells. So if everybody is over here being TH1 and TH2 and we're freaking out and we're very inflamed, how many do you think are left over? This is a simple math problem, guys. So for those of you who are doing homeschooling with your kids, I'm sure you're very familiar with the math. You only have so many of them are over here. You only have a small amount left over then to be those Treg cells that are going to really determine, is this something I should freak out about or not? Okay, and again, this is critical for our body to maintain balance, maintain homeostasis, and be able to function appropriately. So let me just look and see if we left anything out. I think that's kind of it. The study that I'm referencing, I'll put up the link probably in the next day or so. There's a really cool one coming up tonight. The post this evening is about hydroxychloroquine and its evolution, so I hope you enjoy that. But aside from that, then keep your comments coming. I look forward to hearing from you. And make sure that you're subscribing and you hit the notification down below so that you can be notified when we're posting again. I hope this helps. If you have any questions, give us a call. Bye-bye.